It's very important that nurses are flexible.
Here we go. Actually, I needed to have this up. So I do nutrition in TPN. So I just started off with like a little bit of nutrition basics and what, like we've learned these since probably we first started college and like our basic anatomy classes. But we need carbohydrates, fats, proteins, vitamins, minerals, electrolytes, and water to just survive. Carbohydrates are our main source of energy that we need to get up and move in. Fats is where we store our energy. It also helps protect our organs and maintain body temperature. And then our proteins are amino acids, so they help maintain our body tissue and help maintain our acid and base balance. Vitamins, which I have a little picture of like our water soluble and our fat soluble vitamins, and where we can get that in our food source. So like education pieces to teach our patients where we can get more into our diet. And then minerals and electrolytes. So those both enhance cellular function and body water regulation, and they also help with acid and base balance as well. And then I feel like I've heard this a billion times, but our body is made of 60 to 70% water weight, which is insane to me. We're pretty much just all water, and that kind of freaks me out a little bit.
Or Diet Coke.
Yeah, or either one. Okay. So then a little bit about TPN. We've been learning about this a lot in the past semester and in this semester a lot too. It's a method that we can give our patients that bypasses the GI tract if there's something wrong with their GI tract and they can't take foods orally. It contains lipid, emulsions, protein, electrolytes, minerals, and dextrose, which is why we would start a patient on that dextrose 10% if one of our bags were to be out and we didn't have another one, because we don't want them to crash with their glucose, because that would be not good. So some main nutrition changes in the older adult. I just have a few that we have pretty much been over. They have a loss in sense of taste, smell, and appetite. It usually declines after, I think it's like 55, it starts to change a lot. The lack of physical activity could lead to a decreased appetite. Some illnesses that can affect nutrition could be heart disease, cancer, COPD, osteoporosis. Those can start to lead to more problems with malnutrition as they have restricted diets. Maybe they can't chew as well, maybe they can't swallow as well. Some medications, I have a whole list of what later on that can affect their nutrition and what can happen with those. They're weakening immune systems, which plus malnutrition can be just a lot for infection, poor wound handling, and muscle weakness. And then generally, they have a lower calorie need, but I read that they have an increased nutrient need than most younger adults because their immune systems are just crashing, so they need more and more and more. So I did some signs and symptoms of malnutrition that we can look for within our hospitals and in our patients. I found this really cool diagram. I didn't write it all out though, just because it kind of spells it out for you. But symptoms, a lot of symptoms of malnutrition can mirror the symptoms of the aging process, which makes it hard to see malnutrition in our older adults. So like unplanned weight loss, feeling weak or having lack of energy, that loss of appetite, swelling or fluid accumulation, especially in the feet or in the legs, only being able to eat small amounts of food at a time and starting to feel cold just because they're losing that fat that they have had. Also, the skin and hair will start to become dry, dry and brittle. And then they'll have that lack of skin turgor, which we know to check on the arms, not the hands, because of the tinting. Constipation, longer healing times, and risk of infection. So I just took the picture right off of the map. And then I highlighted what I thought was going to be like the most important ones. So the first one is safety and infection control. So for this one is allergies, because if you give food that they're allergic allergic to, that could not be good. It could cause their throat to swell up and all that. And then the assessment of their care environment. I just thought because their immune systems are decreasing, they're becoming more weak, and then that could be a fall-induced thing since they're not eating, so they have like a higher risk of falling. Properly identifying the client when providing care, so like writes medications or like their dietary restrictions. Same with the TPN, you don't want to give someone TPN who is not supposed to be getting TPN. Verifying the accuracy of the treatment order. So like if you know that they need, or if they're starting to choke, you can recommend like a aspiration or like a dysphagia diet. Safety issues. So I saw this one as if they're not able to get the spoon up to their mouth to feed themselves, to use those like orthopedic devices that can help them feed themselves almost, or stay in the room with them to help them eat. Same thing with the safe use of equipment. Yeah. And then educate the client and staff regarding infection, so like precautions to help them not get more weak, to help them try to gain their control. So health promotion and maintenance, so providing education for the adult client over 65 years. I would say like educate how they're, I don't know how to say this, like getting older, so what they should be expecting, and to have their dentures try to fit, try to chew, swallow really slowly, have them sit up so they're not choking, so they can get that food down. Teach them how to get adequate nutrition depending on their culture, because some people can't have like pork, or some people, like just their cultures are different with nutritional values. So assessing the client's readiness to learn, learning preferences and barriers. I saw that as something, or a patient with dementia or Alzheimer's who could have a barrier in the nutrition status, like forgetting to eat or not, can't like learn or take in what we're trying to tell them as far as like when to eat or what to eat. And then I kind of accidentally cropped this last one out, but it's assess client ability to manage care in the home, in their own environment when they go home. So teaching about those devices too. We're teaching what kind of foods, what nutritional values they need, so higher nutritional stuff, and to get food and fluids in. And then this one with the health promotion and maintenance also, the health screenings to target possible like disease states that could affect their nutrition decline. So for the psychosocial integrity, assess the clients for abuse and neglect and report and intervene. So I saw, or I read, I actually watched a video on like the adults and how you can spot it. And big ones were weight loss, the malnutrition look, and then confused or dehydrated if they come in and you notice like a really steep decline. Assess the client's ability to cope with life changes and provide support. So depression could be from a loss of a spouse, a family member, or a friend. Depression can really take a hit on your eating habits. You just don't really want to eat anymore. And then that could lead to a lot of malnutrition issues. So again, different cultures have different nutritional values. I found one of the bigger ones is like pork. With the Jewish culture, they don't eat pork. So just a different type of cultures have different nutritional stuff. Provide care and education for some health issues. So I kind of saw that as like end of life care. People who are going through end of life care usually would get TPN because they're not allowed to, or they can't consume food most times. And then helping the patient eat, sitting with them, making sure their food is in reach, giving them what they need, helping them get their fluids in, their foods. Some basic care and comfort things to assist the client who has a sensory impairment, so helping them with their devices. Maintain skin integrity, so dehydration and skin can kind of go hand in hand, so making sure you do your skin assessments, make sure there's no new wounds, because it also could affect their wound healing, so just making sure their skin's intact and all that. Basic care and comfort also, it had a bunch of like nutritional status, so just making sure that they're being monitored properly, looking at those pressure wounds, looking at the skin integrity, their hair, their teeth, their mucous membranes. You could also check their lab values, like their electrolytes and blood levels, and hopefully you can make like a recommendation to the healthcare provider if you notice something's declining and they need like a higher assistance. So for some pharmacological therapies, we talked about that TPN, which could be through the central line, the PIG line. Usually it's infused over 24 hours, so when it says perform calculations, you could calculate how much fluid they have and then just divide that by like the 24 hours to see how long it needs to infuse. You want to make sure you're monitoring them for like fevers, chills, their electrolytes, white blood cells, just to make sure that there's no like interactions going on, so they're not having like any allergies. And then there was a lot of stuff about nutrition. There's like a whole book of nutrition that they gave us, which was really helpful for the complications of TPN. And then vitamin and mineral supplements. There was iron, vitamin B12, the folic acid, and potassium and magnesium. I actually have all of like the contraindications and stuff in like the notes of the PowerPoint.
Cool.
So I can send it to everyone and I have it all like
That will be helpful.
like spelled out at the bottom. Because I know one of them, I think iron is the one where it like stains your teeth, so you want to like have it with a straw and then make sure you eat it with food and stuff like that. And then medications that can affect the nutrition would be stuff like laxative, antidiarrheals, and antiemetics, just because like vomiting, diarrhea can just really dehydrate the patient. So you want to make sure they're getting their foods and their fluids in. Reduction of risk potential. So comparing their normal labs, or what's normal to them, to their lab values and seeing how the electrolytes are going up or down, seeing what their dehydration is doing. Especially on TPN, you want to monitor their glucose, especially at the very beginning, just to make sure they're not going into like a hypo or hyperglycemic state. Nasal and oral GI tubes, we need to make sure they're properly placed and being aspirated to make sure that we know that they're properly placed and working. The PEG tubes, we like to assess for the redness, make sure that it's not being infected and that the food, or technically the food, is going in properly and they're getting that proper nutrition. Risk potential also of like choking risks, aspiration risks. Want to make sure their diet is good for what they are at in the hospital. And then infection, just because their immune system's probably really weak, so just making sure that they aren't like spiking a fever or like having like increased blood pressure or something like that. And then I didn't have much on this part, just about the ventilator. People who on vents normally can't tolerate PO, so that they need some sort of other nutritional value. Making sure that they have all of their supplements that they can get, and then just again to recognize the declining status and nutritional stuff, so like confusion, bruising, appetite loss, stuff like that. And then I have some questions.
Esther, what's the answer?
I mean,
No. I would just because of the prior, asking the text to always assess.
Yes, it is. And then I
Sorry.
have like
no, you're fine. I was still
rationales
reading when
and
you asked
stuff
that. I'm
under
like,
this
wait, what?
too, so if it didn't make sense, there's like rationales for each question that I found. It was really helpful.
Ooh, we got troubles.
What's appendiculus?
You don't know that word? I was introduced to it by an OB, a pandus. You know what like the pandus is?
It's like this full of skin on your side.
Uh-huh.
Oh,
I know.
Like an apron or something.
The apron, yep, I know these women.
Okay.
Men can have, but usually we're not women. Probably yeast.
This one is D.
Oh, they knew that, you guys knew that, right?
Yeah.
30 mL minimum, yeah.
And then last one.
Oh, and it happens even though you started calling pharmacy 2 hours before it's gonna run dry.
B. You guys are so smart.
That will so be in your English.
That was
If it is not a white margarita,
That was my last exam.
The last
Yes.
margaritas?
if it is not on your NCLEX.